Many people go under the knife to get that perfect swimsuit body, but you may be surprised by the latest generation choosing to enhance their body. Here's NBC's Aditi Roy. Dr. Michael Salzhauer is a Miami-based board-certified plastic surgeon, and Vivian Diller is a clinical psychologist and an expert on aging and beauty. Good morning to both of you.
Good morning,
Doctor, is this a broad trend, or is this sort of anecdotal here and there?
No, absolutely. Because of advances in healthcare, Americans are living longer, healthier, more active lives. And they, like the lady on the tape said, they want to look as good as they feel.
Yeah. So when they come into you, what do they say? What's their motivation?
Well, their motivation is that when they look in the mirror, just as the doctor said, they don't see the person that they feel they are inside. They feel they're looking older, their bodies are heading south, so to speak, and they're asking for help.
Yeah. Is it because they want to date and look good, or they want to look good at the office and look younger?
There are a variety of reasons that seniors choose to have plastic surgery. And it's very important that as a surgeon I delve into those aspects and find out exactly why. They can vary from, a widow, a person who's divorced, who's out there trying to date and attract a spouse or a mate, or an aging salesman, senior, who wants to compete with younger salesmen and stay in the workforce longer. So there are a variety of reasons why people have plastic surgery after age 65.
It sort of flies in the face of aging gracefully, doesn't it? I mean, how much do you worry about the psychological impact of all of this?
They're very important issues. I mean, the positive side of this is that people are living longer. They want to live that life passionately, robustly. They want to feel as good as they look. That saying that 50 is the new 30. And I don't know if that's so true, but we do have to ask this important question. Is it in the best interests of this patient? We don't know yet. The jury is out. The data is not in yet for what it really means to somebody in their 70 and 80 to get this surgery. Will it actually give them what they're hoping to achieve?
Right, and we should point out, we're talking some major surgery here, right?
Sure. And it's important to remember the difference between chronological age and physiological age. So someone in their 70s who's lived a healthy life and is still very active can have no greater risk for surgery than someone in their 40s. Under similar circumstances. On the other hand, someone who just has poor genetics or poor health habits, etc., might not ever be a candidate for plastic surgery.
Is there a limit to? Is there an age limit in which you say, "Look, I'm not doing this procedure for you"?
I think
sorry.
what you have to consider is the fact that recovery time is a little longer. How will this impact their life for how long? Are the risks worth it? Sometimes one surgery results in another desire for more surgery. You get your breast enhanced and then your neck doesn't look so good. That's a question we have to ask when you're in your 70s and 80s. That's different
But how old is how old, really?
Well, age is just a number, and it depends on the procedure that you're going to have. I've operated on 91-year-old people who are very, very active and very healthy under conscious sedation, doing an eye lift, for example, or a neck lift or a facelift. On the other hand, a tummy tuck or a breast lift operation is much more invasive, and therefore they have to be in better shape for that.
Yeah, recovery time's a little longer when you're 100.
And like I said before, every patient has to be considered individually, both psychologically and physiologically.
It's interesting, and it's a good debate. Dr. Salzhauer, thank you, and Vivian Diller.